As I am making this is the second week that I've been home now from the hospital, and I just wanted to share a little bit of the videos that I took in the hospital. And right here I want to mention that this right here was it compresses your leg, the machine. It throws air in these compression stockings that I had around my legs to prevent any blood clots. Well, you actually see it working here.
Well, this is day 2.
This is Jedis for Jesus.
Second full day that I've been home. It's Saturday, and I got home Thursday about 4:30 in the afternoon, and there's my little dog behind me keeping me company, little sweetheart. Yeah, there he is. Yeah, he's been good, not getting on my lap like he normally does and like he would like to. So, yeah, I thought I'd just tell you how I feel today, and I don't know, medication or just don't feel well. My stomach hurts. Don't know if it's the it's probably all the above. Incision that I have. I'm prone to being constipated. I'm happy to report that I had a bowel movement in the hospital on Wednesday, and then there was no problem for them to release me on Thursday, because they want you to pass gas and have a bowel movement before you leave the hospital. So I'm glad that happened. God is good there. Also, just wanted to, yesterday was a pretty good day. Had some people from church over visiting. That was really nice. I really appreciated that. I really felt good last night, and things turned just like that. The next day you feel like garbage. So morning's over. It's now high noon, and I'm just hoping this passes and maybe I feel better later this afternoon or this evening. But definitely we'll be giving you my updates.
Almost to the day I had surgery 11 years ago. I was just, looking around on Facebook, and all the things that are right there, most of those things you can take from the hospital. They might be good for you to have at home for recovery. And this next video here is me just trying to get a little bit of exercise as I am waiting for them to bring the wheelchair. So they have you get up pretty fast and walk around the hallways. I'll be happy to get rid of this thing, still have it attached to me. So the first few days they had me on this liquid diet. Oh man, was I tired of getting this for breakfast, lunch, and dinner. They do it a little bit different, but basically this was it. So Wednesday night I had this. Thursday was the day I went home, and I didn't really eat anything. I did not feel good. So maybe I shouldn't have ate half the meatloaf. It was good when I was eating it.
When you're sitting here, make sure you have everything. It's like
one of these is great to have, but sometimes it gets away from you. But pillow, my back brace. You're supposed to have that on when you get up. Pillow for maybe the back of the head, but one of the most difficult things to do is get up, and you better have some kind of strength in your arms. This ain't gonna do any good. So just think about having IVs. You saw the pictures before on your hand. You know, you wanna make a fist or whatever, but trying to do that, make a fist and put it down here, and you gotta be as straight as possible and have your back straight and get up. And then you gotta take one hand and put it on the walker, keep straightening up, and then get all the way up like this. And yeah, you gotta push. That's a lot harder than what I'm about to do now, is sit back down on this couch. It's like, but still again, you bend your knees, hold on to the walker, bend them. I got something on where, you know, it's like you gotta pull up a little bit on it. Make sure your seat is clear back there, and then have your hands out and you start coming down, and you want to squat and make sure your back is as straight as possible. And then you just come down and you want to hold your weight and just come down easy. And as you're coming down, make sure your back is straight. Easier said than done. And yeah, there's some pain until you do settle down, get all the way down into the seat, and then, you know, you got your pillows, you got your blanket, you make yourself comfortable. And this is one of the most comfortable positions for me, is sitting down here like this. And you know, I showed you this before. Gotta have this on still. And then there's a little table over there, but that's not next to me, because otherwise, to get around the couch here and out, the little table gets in the way. That's right over there. You really have to think before you have this surgery, even simple things like trying to reach the toilet paper roll to wipe. That's going to be too far. So what I like to do here is have the toilet paper, some wipes, different kinds. You're not going to be able to shower for up to 2 weeks, they say. So the bigger wipes like that, you can get them at the hospital. They might give you some before you leave. That would be great to have, or even these flushable wipes here, just to be able to clean yourself a little bit better, because it's going to be difficult the first 1 to 3 days when you get home. And then also, if you don't have a bowel movement, that's a whole nother problem. I'll talk in the video to come. But here's our shower. Definitely, when you finally are able to take a shower, you're going to want a shower chair to sit down on to take that shower. And I'm going to look forward to that when I get to take my first shower after 2 weeks. But like I said, meanwhile, the best thing for you to do is use the wipes and have that toilet paper handy, because that stuff in the back there, when you're sitting on the toilet, you ain't gonna be able to reach any of that. And especially that roll over here, that's too far. The other thing that starts to be an issue is getting up and using your walker and everything like that. Not supposed to reach too far, but to flush the toilet,
you know, that's a thing you want to be able to overcome too. And it's just using your walker right there to make sure you don't fall down. So this is the third day for me. It's going to be the third full day that I've been home, and yeah, it is a challenge, and it's getting better. Yesterday was not a good day for me, but today seems like it's a lot better, and I'm a lot off the pain meds, and I'm gonna deal with the pain. That noise you're hearing is this thing needs to be charged down there, and that's suction. Gets the moisture off my wound, and yeah, I'll show you that later too. So anyway, yeah, get off the pain meds as soon as you can. So especially like me, I got a lazy colon, and yeah, it makes you feel awful when you're all bloated. So wanted to go ahead and show you what you would possibly do is you go ahead and take this from the hospital. They give you one of these. What's great about this is you put this underneath your chin, and you go ahead and, you know, you can spit in here, and then just makes it easier when you're going down here. You can go ahead and rinse it off and just do what you need to do. And then I really can't bend over or anything like that, so I get the water nice and hot, and then since I really can't bend over right now, I like to freshen up my face and stuff like that. So I'll go ahead and use this and clean it. I'm doing what the doctors tell me to do, and that's basically no shower for 2 weeks. So, you know, hopefully you have somebody that can wipe you down, give you a sponge bath, as they would say. Or, you know, like I said, I don't need to do that every day, but washing my face, brushing my teeth, maybe running a comb, brush through your hair, just makes you feel better. You know, and you get very itchy. So that's some other things. And like if you want to shave, you know, I would recommend, you know, you don't want a blade or anything like that, but I'm the kind of guy that takes the, I use my electric razor. So like down here, I want to maybe clean that up a little bit, or right here. And the other thing that I really recommend is maybe before you have surgery, what you wind up doing is, you know, I don't know, shaving your head so you don't have any hair up there, clean shaven, and then it starts growing back in. But yeah, you got to be prepared, because it might be 6 weeks before you're allowed to bend again. So all these things, that's why I'm making the video. I've seen a lot of videos out there, and they don't mention certain things. And every once in a while I get this pain in my gut right here, and it's like I believe that's like a muscle spasm, and it's like, oh, it's painful. So yeah, and these are great too. These washes from the hospital. There's 6 in there, and I got 2 packs. So that's great to have. And I did look on Amazon. You can buy those too. So that's great to, you know, have that body wash. So if you don't have somebody to help you out, you know, I feel for you. So you definitely want somebody to help you out. That, you know, a lot of your dignity goes out the window when you're in this situation. So I hope this helps, and more videos coming.
If you got any value out of this video, please like, subscribe, and hit the bell to be notified when we upload a brand new video. Thank you. This is Jedis for Jesus. Hope to see you one day soon in heaven.